What if next big hair loss treatment doesn't block hormones, doesn't rely on the usual minoxidil pathway, and may not come with the sexual side effect fear that stops so many patients from even starting treatment? Hello everyone, I'm Dr. Ko. Today, I want to talk about one of the most interesting new hair loss molecules people have been asking about lately, MLPH. And I'll tell you right away why this topic is getting so much attention. Because for many patients, the biggest problem is not just hair loss. It's hesitation. They know treatment exists. They know earlier treatment usually works better. But they pause. They worry about scalp irritation with minoxidil. They worry about sexual side effects with finasteride or dutasteride. And many women feel that their options are narrower, more complicated, or less straightforward than they should be. So when headlines start saying there may be a new treatment candidate that promotes hair growth without directly targeting sex hormones, people immediately pay attention. And honestly, I understand why. Because that would be a very big deal. Now, before we get too excited, let's slow this down and go step by step. First, what is MLPH? MLPH is a peptide-based experimental hair loss treatment candidate developed from research on erythropoietin, or EPO. Most people know EPO as a hormone involved in red blood cell production. But researchers have also been interested in the fact that EPO can interact with receptors in hair follicle-related cells and may support hair growth signaling. The problem is obvious. Using EPO itself is not practical for hair loss treatment, because its blood-related effects could create serious safety issues. So the researchers tried something smarter. Instead of using EPO as it is, they designed a peptide that keeps the hair growth-related signaling idea, while trying to avoid the unwanted erythropoietic, meaning blood-forming effects. And that peptide is MLPH. This is the part that makes the story interesting. Not because it is already a miracle drug, but because the design logic is very different from what most patients are used to hearing. Minoxidil helps stimulate growth. Finasteride and dutasteride reduce DHT-related pressure on susceptible follicles. MLPH is being presented as something else entirely. A molecule designed to activate signaling in dermal papilla cells, the command center cells that help regulate follicle behavior. In simpler words, this is not just more blood flow and not just less DHT. It is a follicle-targeted signaling approach. Now let's make the mechanism easy. Think of MLPH as a precision messenger. Instead of broadly pushing the system, it tries to deliver a more targeted wake-up and grow signal to the follicle environment. That is why people are calling it promising. Now here's the part that matters most to me as a doctor. Promising does not mean proven. And this is where a lot of internet content goes wrong. The current MLPH paper is exciting, yes, but the evidence so far is preclinical. That means cell studies, tissue studies, and animal data. That is not the same thing as real-world human clinical success. Many compounds look impressive before human trials. Far fewer become practical treatments. Why? Because once you move into actual clinical development, the questions get harder. Can it be delivered effectively into the scalp? How often does it need to be used? How durable is the effect? Does it work in men and women equally well? Can it help early thinning only or more advanced loss too? Will the safety profile still look clean in larger, longer human studies? Those questions are still unanswered. So I would be very careful with phrases like, this will replace finasteride, or this will be available very soon, or this has no side effects. That is not what the evidence shows yet. What the evidence shows is narrower, but still meaningful. And there is another reason this topic is getting so much attention: women. Because one of the frustrating realities in hair loss treatment is that women often feel stuck between weaker over-the-counter options, off-label paths, pregnancy-related restrictions, and fear of side effects. So any future treatment candidate that is not built around the classic hormone-blocking pathway naturally gets attention from female patients too. Existing mainstream guidance still centers heavily on minoxidil, while finasteride use is more constrained depending on sex and reproductive context. So what is the real takeaway? MLPH is not the cure that arrived. It is the signal that the field is still moving. And that matters, because it tells us researchers are trying to solve the exact problem patients keep bringing up in clinic. I want effective treatment, but I'm scared of the trade-offs. That is a real concern. And finally, it is being addressed in a more direct way. But until a treatment like this actually passes human trials, the smartest strategy is still very boring. Protect the hair you still have. Do not wait for the perfect future drug while your current follicles continue to miniaturize. Because when better treatments arrive, the patients who benefit most are often the ones who did not let the condition progress too far in the meantime. Current mainstream guidance still emphasizes early evaluation and evidence-based treatment rather than delayed action. So yes, MLPH is exciting. Yes, it may become an important future option. And yes, I think it is one of the more interesting new hair loss stories right now. But for today, the right mindset is this: stay curious, stay realistic, and keep the hair you can still save.